Good afternoon, commissioners and community members. My name is Stacy Wood, and I serve as a public information officer in Buncombe County's Emergency Operations Center. And I'm here to introduce our presenters today, but also wanted to remind the community of a couple of updates and kind of housekeeping items. So while the day-time format is now a little different for these COVID-19 community updates, what is offered during the community updates remains very important for our community to know about. And so we just want to remind the community that we are still providing these community updates. They are here at the Board of Commissioner pre-meetings at 3 p.m. every other Tuesday. And so today we have added American Sign Language interpretation. And so viewers at home or on your computer or phone will see an American Sign Language interpreter up at the right-hand side, top right side of their screen. And so we're running into a couple of tech issues today with the simultaneous Spanish interpretation, but that will also be provided ongoing. And that version, the Spanish language version, will be available right after today's COVID-19 update. So I just wanted to, those are the housekeeping items. And these will be available for the COVID-19 community updates ongoing. So today's presenters are Stacy Saunders, Buncombe County Public Health Director, and Dr. William Hathaway, Chief Medical Officer for Mission Health in the North Carolina Division of HCA. And we will go ahead and get started with an update from Stacy Saunders.
Good afternoon. Thank you for the opportunity to present today to you. Please note that today I will be using data from the North Carolina Department of Health and Human Services dashboard due to a delay in updating our local dashboard. But this presents a really great opportunity for me to also inform you that we are recommending movement to the North Carolina DHHS dashboard and sunsetting our local dashboard beginning next week. Locally, we supported a county-specific dashboard when North Carolina Department of Health and Human Services did not have a dashboard. Since that time, the North Carolina Department of Health and Human Services has supported a robust and accurate dashboard that includes county-level filters that also include the same information that our local dashboard has on it. And this move really is to eliminate that duplication of effort. As I said, the two dashboards essentially have the same data on them. And so this will allow our team to now put those duplicative efforts toward other efforts here locally, including the support of our case management or our case investigation, contact tracing, testing, access, and other future COVID response plans that we have. And so first up, for us here in Buncombe County, as of this afternoon, there are a total of 3,800 confirmed cases. The majority of these cases, about 41% of them, have occurred in 25 to 49-year-olds. And you will see here, by using the North Carolina DHHS dashboard, there's additional information that they have that our local dashboard doesn't, which is not only the PCR molecular confirmed cases, but also the antigen. We've also experienced 98 COVID-related deaths. The majority, as you've heard me say before, the majority of those local deaths are occurring in age groups that are over 65 years and associated with long-term care facilities. I'm going to zoom in a little so that you can see we saw a large increase beginning in early July and throughout the summer, with a leveling throughout September, and then at the beginning of the end of September, we actually started to see a steady increase where we are currently seeing about 30 to 33 new cases per day. And I just wanted to note that as our communicable disease teams are doing the case investigation, they're not finding any one particular location or facility site that that folks are visiting more than others, but what they are finding is that people are out and about, sometimes with symptoms, and sometimes, they're putting people at risk due to their symptoms, but also folks are not adhering to the precautions like keeping 6 feet apart. So when we do our case investigation, that's what we are commonly finding. And so, I again take the opportunity to let everybody know that it is very important for our community members to remember that if they have symptoms that are associated with COVID, we want them to stay home, not to interact, to contact their providers for assessment and testing if necessary. And then speaking of testing, we also want to remind everyone that testing is available at several different community sites, including community partners like our FQHCs, our urgent cares, our pharmacies, and also at our own community testing sites. And we are currently scheduling our fixed sites and our pop-up sites into November. And folks can visit buncombeready.org, and if you choose the testing function, you'll see a calendar or a list of testing options at the bottom from this month and then beyond. And I just want to, as I said, since our case investigations are showing that folks are moving about with symptoms, I want to say symptoms or no symptoms, it is very extremely important for individuals to remember to wear their face covering, to keep 6 feet apart, and to wash their hands to lower their risk. If you are having symptoms of that are associated with COVID, we want you to stay home and contact your provider. So just to reiterate that when we don't adhere to the guidance of the 3 W's, we are actually helping the virus spread, and that is not what we want. We want folks to adhere to the 3 W's so that we reduce the risk of infecting our neighbors, our friends, our families, and others in our community. So speaking of the COVID testing efforts, the ones in our community have resulted in about 86,000 tests administered throughout the community. And as I've said before, those testing efforts help us not only identify cases and quickly get them isolated so that we reduce the spread of virus, that testing also helps us understand community transmission because it allows us to then understand the percent positivity, so the number of those tests that are coming back positive. The last time I spoke to you all, the percent positivity was about 3.3%. As of today, it is 3.5%. The state's current percent positivity has increased from 6.4% from the last time I spoke to you all to about 7.4% today. And again, while our percent positivity is less than the desired 5%, which is good, it has increased since September. And in order to reduce the spread of virus, I can't say it enough, it is very important for all of us to use the precautions that we have in place, which is to limit our interactions, wear a face covering, wash our hands, and keep 6 feet apart. Those are our best defenses right now. Now is not the time to let our guard down. And lastly, I'm going to share just the COVID-like illness report. This graph shows the percent of emergency department visits in North Carolina for COVID-like illness through the week ending October 15th. Just a reminder that we are that bright yellow line, but one of the things to note here is that across the state in each of the regions, we are seeing an uptick in that COVID-like illness. And so this is a good time to turn it over to our guest, Dr. Bill Hathaway, Senior Vice President and Chief Medical Officer for Mission Hospital, to talk more about hospital and health system.
Thank you, Stacy. It's a pleasure to be here again. It's been a while since I've seen many of you, or at least in this venue, and I appreciate the opportunity to come back and address you and the community. Let's see, if I can handle the challenges here. As Stacy appropriately pointed out, we have been seeing an increase, and I think we're all aware of COVID cases across the United States, and COVID deaths continue to occur. The shapes of these curves that you'll see that Stacy presented and I presented are very, very similar, meaning that what is happening nationally is happening locally, and we all need to be very aware of that. We've tragically passed 8 million cases and over 200,000 deaths in the United States, and most of us are well aware that that's very disproportionate to our population. At Mission, I wanted to provide an update of what we've seen, and you'll note that on this chart, this graph, the blue curve represents the total numbers of patients we've had hospitalized since March up until this morning, and the gray and orange curves represent those in the intensive care units and those on a ventilator in the gray. What you see is concerning to me is we are approaching, if not surpassing, our peak of patients that we had hospitalized in July when we hit our first peak, and now have gone up again very steadily to the current values of about 35 to 45 patients in the health system at any given time. Most recently, we've had 31 patients hospitalized this morning, 8 of whom were in the ICU. What I find most interesting, however, and perhaps slightly encouraging, despite the recent rise in the cases, is that while cases have risen, the numbers of patients that we've seen in the ICU is remaining flat, and that's encouraging to me. I don't have an explanation for that, lots of proposed explanations, but encouraging to me, it means that we have adequate resources, we have adequate beds, ventilators, testing supplies, and PPE to handle the surge right now, and we are certainly much better off than we were back in March when we first encountered this illness and had very much limited supplies. So I want to echo in closing my comments here what Stacy said, is that our best defense at this point in time are the 3 W's: wearing a mask, waiting 6 feet apart, and washing our hands and keeping them away from our mouths and face. We anticipate and hope for a vaccine. The vaccine will come. We just don't know when it will come. Both the health department and Mission Health System are in the process of coordinating with the state to obtain supplies of those vaccines. But the best strategy we have now and even into next year is to be mindful of social distancing. I think we can do that safely and effectively and still move towards protecting each other and getting back to where we need to be in a more normal state for our community. Thank you very much.
Thank you.
Any questions?
Thank you for the presentation, both of you. I wondered if you could share with us sort of any of your thinking about if there are threshold levels at which it might be most responsible to consider re-implementing some of the policies that we had between the sort of March and August timeframe. I think obviously no one wants to do that, but as we see these numbers and know that we're approaching sort of the confluence of flu season and COVID in an ongoing way, I'm just interested in sort of the latest thinking on what we need to, when we go into sort of that yellow zone, when we're in that red zone, and any thoughts on that?
Yeah, thanks so much for the question. And so one thing I'll first say is that not only am I looking at these every day, but every week we are looking at these through our our command center and monitoring these trends over time to see if there's any other decisions that we need to be making. As to true demarcations of thresholds, I would say the things that we look at the most would be what are the new cases per day coming in, how steep is that curve going, and percent positivity, because that is one of our best indicators of community transmission. And so one of the other things that we look at too, as I said, is that anecdotal type of data that we get from case investigation, which is are we seeing something within our community that needs us to take action? And right now, what I can tell you through those case investigations is it's that individual behavior of we have to remember that 6 feet is really important. We have to remember that masks are really important. There's growing evidence about how important masks are right now. And then, of course, we would be looking toward our hospital partners, too. And just as Dr. Hathaway stated, looking at what the hospitalization rates are, what are the ICU, are we reaching a capacity? And right now, as you heard Dr. Hathaway say, that there's still capacity within our hospital at this point. So, but it is monitored daily for some of us. And then most certainly every week we are discussing that in our command center.
Thank you.
Uh-huh.
I have a couple questions. One is looking ahead to the fall and winter. There's long been concern that cases would increase in the fall and winter as people have less opportunities to do things outdoors, and there's just more happening indoors. People are, indoors in close proximity, and that's obviously a lot more favorable environment for transmission than when people are outside. So, is there, based on everything that we've learned so far and the trends we have right now, is there any way to kind of do forecast for our community around what we think the fall and winter might look like? I realize, this is such an unprecedented situation. It's all kind of asking you to talk about looking into a crystal ball, but nevertheless, I guess I'd like to hear your thoughts about what the best thinking is on that based on the learned experience we've had so far.
It's a really good question, Commissioner Newman, and I appreciate you bringing it up. Obviously, we're concerned about the confluence of the influenza season and the ongoing COVID season, as it were. Some have referred to it as a possible twindemic. There's been a lot of thought about that, and we are at least mildly benefited by the experience of what's happened in the southern hemisphere. Specifically, the flu season comes to the southern hemisphere before it comes to the northern hemisphere. And so we get an idea of what the flu season is going to be like each and every year based on what we've seen in Australia and New Zealand and South America and other places. Interestingly, and we don't know how to explain it, it appears that it's not as vigorous a flu season as it has been previously. And some have argued that this is because these two respiratory viruses are competing for the same host, as it were, the same person to infect, and that one tends to dominate and predominate and win out biologically. I'm not sure I completely buy that. It's interesting. It may be that there's some reporting issues related to the pandemic. It may be related to the fact that we're all masking anyway, so flu season is down. It's hard to know. But I think I'm hopeful. I do know it's going to get worse, okay, because as you pointed out, as we move inside and as we have the behaviors, we see it every year that respiratory illnesses rise in the winter and fade away in the summer. That will happen here too. But I'm hopeful that based on the Southern Hemisphere experience that we'll be okay. It harkens us all to remember that the flu vaccine is recommended. We have a vaccine for the flu. It won't protect against COVID, but it's critically important that each and every one of us above 6 months of age get the flu vaccine. It's completely safe. There are very, very few, if any, medical contraindications to getting it, and we encourage you to get that flu vaccine. Nobody wants either COVID and flu together or COVID followed by influenza. That would be a disaster. So that's one thing that we can do in addition to following our 3 Ws.
Okay. The other questions that I wanted to ask have to do with holidays. So Halloween is coming up, and would appreciate hearing any thoughts from you about, this holiday, and a lot of people have a lot of fun, and it brings a lot of joy to a lot of kids, in our community. But I hear a lot of people asking about, what should it look like? So I just, or
Yeah.
should people do it at all? If they do, how should how should they do it? So I'm sure a lot of people would be interested in hearing your thoughts about this.
Yeah, and I think I want to recognize that it is tough. It's been tough on folks, right? And so I would draw folks to North Carolina Department of Health and Human Services has a really nice Halloween guidance document that talks about the level of risk. So it's important for folks to know that activities have risks to them right now, and so that there are choices that we can make that are less risky. And so, our traditional Halloween with trick-or-treating at door to door and sticking your hand into a bucket is not ideal and is not recommended, right? But there are other less risky activities or activities that have less risk than traditional Halloween. And so we would encourage folks to look at that guidance and to think through what other Halloween activities can you partake in that still, allows you to enjoy the spirit of what Halloween is without putting yourself at great risk for contracting the virus.
Mm-hmm. All right. And then I guess my related question is thinking a little bit further down the line. We have Thanksgiving and we have Christmas coming up when, families travel and get together and spend time together. And it's a really important time for people. But just thinking about, what I just described, it also sounds like, especially for a lot of folks who might be more vulnerable to becoming seriously ill if they contract COVID. Any thoughts you would share about folks, because a lot of people are planning now for what they're going to do in November and December. So I'd welcome any thoughts around that as well.
Yeah, so, and this is not unique necessarily to Thanksgiving and Christmas, because we've seen this happen throughout the summer too, when families were trying to get together for cookouts or for vacations. And so, there is a higher risk for as we bring activities indoors. And so things that we would want people to consider is if you have folks in your family who are in these high-risk groups, it's important to protect them. So your holiday might have to look a little different if you really want to protect our over 65 population, or if you have someone, regardless of their age, in your family with a chronic condition or a underlying health condition, that your Thanksgiving and your Christmas might look a little different this year. That, again, we recognize that this is hard on people and that we want them to make choices that are responsible and that are putting themselves at the lowest amount of risk. And so to remember that when you're coming together in any type of gathering, you are, again, inherently putting yourself at risk because it's an interaction and an exposure. So to remember the 3 W's as much as possible. And that means, when we're meeting with our families, that means that, when we're in those spaces, keeping our distance, washing our hands as much. If, the 3 W's are additive. So when we use them together, that's our best defense. If one of them is not possible, that means we have to really double up on the other 2. So for folks to remember that too. And just to remember that those of us who have family members who are in those high-risk groups, now is the time to be thinking of alternatives and how we want to celebrate in a safe way that keeps them at the lowest risk, if at no risk.
All right, thank you. Commissioners, other questions? All right, thank you both very much for being here.
Thank you all so much.
We really appreciate you. All right.